Let's talk about passing standard, right? Let's talk about what? Passing standard, right? Because you have above, near, and then we have below, right? Above, near, below. Now, you have the RN exam, you have the PN exam. Now, passing standard for RN is 0.00 logit, and then passing standard for PN is negative 0.18. Meaning, let me show you real quick. Now, this is what it is. Now, so if you have your scale like this part is 0.00, right? So, and then here will be negative 0.18. So when you are answering your question, right, you need to be what? Above the passing standard. So anywhere here is what? Above. Anything closer to this area is what NCLEX call near, and anything less than this is what we call below. Now, to be below the passing standard, you need to be below 0.18 for PN, right? So if RN is right here, they fail the NCLEX exam because the RN logit is 0.00. But if PN is right here, they fail the NCLEX exam because the PN is what? Negative 0.18. So that is how it works. Near the passing standard, you are borderline. Below the passing standard, you are very below, and above, you end up what? Passing. Now, when students fail the NCLEX exam, right, you are going to get what we call candidate performance report, right? A lot of students will say test report, or a lot of students will say CPR, candidate performance report, right? So this candidate performance report will tell you where you are above the passing standard, where you are near the passing standard, and where you are below the passing standard. Now, this is it. A lot of students don't get to see above the passing standard in their test report. So they only see near and below. But above is part of it. So if you are not seeing above on your passing standard, it means that you, out of every category, you did not have any area that you were clearly above the passing standard. Now, a lot of students as well too don't see below, they see all nears, right? And they don't see above as well too, right? So if your exam is all near, right, it only means that you did not add any above, which is good, below, which is good, and you do not have any above, which you need to work on, right? A lot of students see a lot of below more than near. That is not good at all, right? You need to work on that as well too, right? So yeah, that is just briefly what you need to know. But another question a lot of students ask is, do I need to be above the passing standard in all area in order to pass the NCLEX exam, right? If you've been hearing that, that is what I call misconception, right? About passing all area above the passing standard. You don't need to be above the passing standard in all area, right? Because NCLEX use estimate of your total question. Now, take for instance, you have you attempt 85 question, right? 15 question is unscored, so you have 70 question. Now, to be above the passing standard for uh registered nurse, remember it's 0.00. So that is average of this, that's half. So that would be any question you answer correctly above 35. So if you have 36 over 70, you are above the passing standard by what? 1 point. But the reason why NCLEX don't tell you they don't give a score to it. Why? It's because one, NCLEX try to test based on competency. That is one. Two, NCLEX is also trying to use this 15 unscored question for future purpose. So there's chances that part of this 15 unscored question might be part of your 36 question you are going to score correctly. Because you can also score part of this 15 question correctly, but they will not be graded. Right. Take for instance, maybe 7 of those questions are part of the 36 you score correctly, and we remove 7 from it. You are left with 29. So then you fail the exam. So that's the reason why there's no specific score percentage you need to meet. right? But most I just tell my students, since 36/70 give you what? 1 point above the passing standard, plus 15 on scored question, plus 15, which give us 85, and this will give us what? 51. So at least you should be 51, you should have 51 correct answer. At least this way you are safe. You are just going to be 1 point above the passing standard. Right. So yeah, but NCLEX want you to be clearly above the passing standard, right? And clearly below the passing standard. That's why we have near. Because I always used to ask myself, why is it that we have above and why do we have below? And we also have near, because above below should be enough, but NCLEX is including near. The reason why is that even if you want to be above the passing standard, NCLEX wants you to be clearly above the passing standard. Right. Now, below you should be clearly as well to below the passing standard. That's what NCLEX was. So near, maybe this is your passing standard line, you are just like this. So you are near the passing standard, you are not clearly above, you are not clearly below. Right. So that's how the NCLEX works. So your CPR, your candidate performance report, your test report is just there to guide you through what you need to perform more on, right? The areas you have near, right? If you have near, the NCLEX is only just trying to tell you, okay, just try to fix little thing and be above the passing standard this particular period of time, right? But if you have below, then you need to fix a lot to, right, be above the passing standard. But if you have above, then you are good. Now, but the problem is this: I've been coaching for the past 2 years, right? I've seen a lot of students who fail 2 times, 3 times, 5, 7, 14. The highest I've seen is 14 times, right? And this particular student passed an NCLEX exam on her 15th attempt, right? So now, but let me tell you what I've seen, because now, if a particular student message me and they be like, oh, I want you to coach me in order to pass the NCLEX exam, because I'm an NCLEX coach, right? Now, the first question I always used to ask is, send me your test report of your previous exam. I always use that. Have you failed before? Yeah, they say, okay, I failed. Most students just send the message directly like that. They just tell me, oh, I want you to help me out. I failed my previous attempt, this and that. So, right, most of them, I don't need to even ask them if they failed before, because they already sent the message. Now I'm just going to say, send me your test report. Let me see. Now, take for instance, someone failed twice. I've seen a particular student. Now, if you fail twice, this is what I always used to do. I'm going to ask you the question. I say, what happened in your first attempt and what happened in your second attempt? Now, when you tell me what happened in your first attempt and you tell me what happened in your second attempt, I'm going to try to see through your test plan to see if it relates to what you are saying. Right. So that way, if it's not relating, I can easily tell you don't really understand much about the NCLEX. That is one. Two, I can easily tell your strength and weakness. I cannot easily tell your strength and weakness from your test reports. Yes, some people luckily be above the passing standard. I've seen a particular student who had above the passing standard in pharmacology, and at the end of the day, I gave a question on most pharmacology question, and she was unable to answer it. Right. So being above the passing standard don't mean the students accurately know that content. They might be lucky with it. Maybe they had easier question, or maybe they guessed through and their critical thinking is right there, right? But we don't want to go, because I teach my students the 3 C's, right? Which is clarity, confident, and then setting. Right. So I don't want you to go on the NCLEX exam and say, yes, I had above the vice standard in pharmacology, but I was not really sure about most questions. I want you to be sure. Clarity, confidence, and setting. That is how I want to go on the NCLEX exam. So that's the reason why I look at it and say, okay, now I'll see a particular student who had above the passing standard. I saw a particular student who have above the passing standard in management of care. And her next attempt, she failed that exam, but she had above the passing standard in management of care. Now, her second attempt, she had below the passing standard, all the way from above, then next attempt below the passing standard. So, what can you say about that? So, if I am to coach you as a student and then I am relying on your test report and I'm saying, oh, you are good with management of care, you did well in management of care, I believe in you. When you do your next attempt, you will also keep management of care. Guess what? If I do that to this particular student, guess what? Look at our next attempt below the passing standard, because we did not cover anything or touch it. So this is what I have been saying for the past 2 years of coaching, right? Some students we have above the passing standard, and in their next two attempt, right, they will have below the passing standard twice at a time. I'll be like, this student had above the passing standard before. So what's happening now? Why are they having below the passing standard? It clearly shows that a lot of students don't understand the exam. They don't understand the content. They don't understand how the NCLEX writes the question, and they don't know how to break the question down. So that is the clear problem, right? That's the main reason why when I look at your test report, because a lot of students, they don't like to have their test report, they angrily tear it, they throw it away, they discard it. Some feel a certain kind of way, they don't want to share it and something like that. So they look for a certain lies to tell you they don't have it again and something like that. Well, guess what? If you have your test plan, it's very important. That way I can be able to help you perfectly in order to pass the NCLEX exam in 85 question. Guess what? If I never knew this student test plan, I would not have been able to help this particular student pass the NCLEX exam on a 15 attempt. Right. So it's very important if I ask you for the test plan, I know why I'm asking for it, right? Because I want to be able to guide you through it, right? And then so that you can be able to pass in 85 questions, right? So that is about the test plan. So if I look at the test plan, I go through it, I know I'm going to guide you and we'll focus on the top 5 area and then the other 2, which is your case study bow tie, and you'll be able to pass the NCLEX exam in 85 questions. Right. So that is about the passing standard. Now, the last thing I want to talk to you about is the amount of question you get in each area. Right. You remember I said you don't need to be above the passing standard in all area, right? You just need to be consistent with being above the passing standard, right? Because NCLEX test for competency, not grade or score or something like that, right? So you don't need to be above the passing standard. The exam is 100%, right? The exam content is 100%, right? Distribution. We have some that 18%, 16%, 14, 13, 12, 9, 9, 9, 1, 2, 3, 4, 5, 6, 7, 8. Right. So 8 client need, these are your distribution. So now some questions are going to come out from this area, 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 this area. Right. So based on those percentage, right? So that way you can easily be able to grade yourself. Now let's check RN first. Right. For the RN content, right? This is how you do your calculation. Me, I always want my student to pass the NCLEX exam in 85 questions. So you are going to say 18 divided by 100 multiplied by 85. So you should get something 15 question right here. Right. So to be above the passing standard, you can divide this by 2, right? You can divide that by 2. So you are going to get 7.5. So to be above the passing standard here, at least you should be having any score um higher than this, right? Because this is going to be your 0.00 for the 15 question, and then you should be having any score higher than that. Near the passing standard is that you are not above the passing standard. Maybe you're having 6 questions correctly, right? Or 7 questions correctly. Now below the passing standard might be you having you scored less than 5 questions correctly or 5 questions correctly, right? So yeah, that is how it works, right? I'm just really just trying to use that to explain, but it's the same explanation work for the PN as well too. But let me give you the question amount you can get here. So here you can get 15 questions. Here you can get anywhere from 13 to, no, is it this? No, this is not 13. Okay, pharmacology. This is anywhere from 13 to 14 questions. 15 question here, anywhere from 13 to 14 question here. Physiological adaptation is the next bigger one. That's 12, 11 to 12 question here. Trying to remember. Then reduction of risk. Okay, reduction of risk, you can have okay, safety and infection control is highest. So here you can have 11 question here. Here you can have 10 question here. Then all these are the same thing, 99%. So you can have anywhere from 7 to 8 question here. So everything all together make up what? 85, your 85 question. Right. So now we have 146 content for RN, right? So 15 questions will be tested in the content you have here, 11 here, 7 to 8 here, 7 to 8 here, 7 to 8 here, 13 to 14, 10, and 11 to 12. So that's the distribution, right? So that's the reason why I don't believe in practicing thousands of question on question bank. That thing is overwhelming, right? When you know what you are doing, you can easily study sensible 200, 300 questions. You are good to go in passing the NCLEX exam. Now, this is also for the PN. So let's do the calculation for the PN. Now, let's start with coordinated care. It's the same thing too. You just need to do what? 21 divided by 100 multiplied by what? 85. So for coordinated care, we have anywhere between 17 to 18 questions. Let's do safety and infection control next. So for safety and infection control, you have 11 questions around that. Right. So for health promotion, you have like 7 to 8 questions. Um, for psychosocial integrity, you have like 10 questions, right? For basic care and comfort, you have around 8 to 9 questions. For pharmacology, you have 11 questions, this 10 questions. And the last part, which is physiological adaptation, you have about 8 to 9 questions, right? That is going to come out from each of those areas, right? So that will make up what? 85 questions, right? But guess what? This is the reason why NCLEX don't have a score or grading. Now, let me go to my whiteboard here. Now, imagine, because now you have what? You have 85 questions. 15 will not be scored, so you have 70 questions. Right. So, which means instead of us to be doing the calculation as 85 questions, we need to be saying, okay, take for instance now, management of care. Let me say MOC, management of care and coordinated care, which is this is for PN, this is for RN. Right. Management of care is 18% content and 21 for coordinated care. Now let's do the calculation. Now this is based on 85 questions we did previously, and then we say based on 85 questions for RN, we should have 15 questions. Based on PM, we should have 17 to 18 questions. But guess what? I'm sure that one of these 15 unscored questions might be from this area. You can see, right? That's the reason why we don't have a score, because you don't know where these 15 unscored questions will be distributed to, right? So, but if you do 15 divided by, if you do 15 divided by 100 times 70 question, let's say we are removing this 15 question, then we do, let us say 17 divided by 100 multiplied by 70 question, right? Then you have about 10 to 11 question here. Initially it was 15, right? And then for this, let us just say 17 divided by 100 multiplied by 70 question. Then you have something about 11 to 12 question here, right? So yes, so at the end of the day, if you manage to what, because we said 15 previously before, so if you have like 7.5, is different from here whereby you may have like 5.5 or 5, right? And here as well to 5.5 or 6, right? So you understand. So unlike before, this was about 18, so this might be 9. Above the passing that would be any question you answer correctly above 9. This would be any question you answer above 7.5. Unlike now, if you do 70%, 70 question, this is what. So regardless, you are going to still pass, right? So this is not to scare you or something like that. This is just to just let you know the calculation, right, of your above the passing. This is just a raw estimate calculation of how your above the passing standard uh should be calculated, right? And what you need is one, the three things I always used to say: your content, knowing how the NCLEX write the question, and then understanding how to break down the question. Now, so far so good, right? I've been tracking back for the past 5 years, right? The pass rate has been between 85 all the way to 94%. So, and we always used to have more than 150,000 nurses taking the NCLEX exam every year. So, if this is the pass rate, it means that only 15 to 6% or 6 to 15% fail the NCLEX exam every year. So the percentage is low. But do you know where the problem is? The problem is when students are repeating the exam. Right. Those problems when students are repeating the exam. Because guess what? This is the pass rate for people that are taking the exam for the first time. Now, people that are repeating the exam, their pass rate RN is 51% to 55%, or let me just say 57%. This is what I've seen so far, so good. Now, PN is 37% to 51%. You can see it. It's not even as high as this. It means that people that end up failing the NCLEX exam, they struggle. You need help. If you are sick, you get a doctor. You want to become a nurse, you attended a nursing school. Now you want to pass the NCLEX exam, right? You need someone who have passed the NCLEX exam before. Right. Now, remember I said we have more than 150 students who pass the NCLEX exam. Few of this amount are interested, not even up to 1% of this amount are interested in coaching another student to pass. Right. A lot might just tell you, oh, I use this to pass, I use that to pass. Me, I don't believe in I use this to pass, I use that to pass, because a lot of students use that specific thing and they also still fail the exam. So it's not about what you are using to pass, it's about what you need to pass, what you need to fix in order to pass. Right. You need a car in order to travel long distance, right? This is your thinking. You need a car in order to travel long distance. Yes, the car can help you travel long distance, but guess what? You yourself need something in order to operate the car. If you don't know how to drive, you cannot move the car. Makes sense. So now, even if a particular student use a certain question bank in order to pass the exam, don't automatically make you as well to use that question bank to pass. So you need something, to fix something, right, within yourself in order to utilize this and then pass, which is understanding the NCLEX. A lot of the students who pass the NCLEX exam cannot really explain the NCLEX to you. All they can just tell you is, oh, I use this program to pass. I use this social program to pass. That is how many of them think. Right. So, but at the end of the day, I've seen somebody that they said, oh, I use this program to pass, I use this program to pass, and then she still ended up failing. She gave up for the past for 10 years. She did not take the NCLEX exam. Right. She did not take the NCLEX exam. She came back, she took the NCLEX exam, she passed. You understand? She passed, right? So it's not about the timing, because most of them will say, oh, I left nursing school 5 years ago, I left nursing school 2 years ago, because that's what they believe that is making them not pass. Right. But that's not the reason why you are not passing. The reason why you are not passing is if you are not fully committed to a certain process, you are not ready, right? Or you are not ready to learn or do the work. That's when you fail the NCLEX exam. The moment you are ready, you want to learn, and you're ready to commit yourself and do the work, you will definitely pass in 85 questions. Right. So, yes, these are things you need to understand, right? You need a coach, right? Somebody that have gone through the process, that can walk you through the process. Because if you try to do it on your own, yes, me myself, I tried to do it on my own, right? And I was like, this is me right here, and this was my exam date. So I was just like this all over the place, you know, before I got to uh succeed. But if you have a coach, now I've gone through this process, I know how it works. Now I can just easily hold you by the hand, walk you through. Yes, we might have little down like this, but trust me, I will shortcut your stress, right? And every struggle, because with my guidance, I'm just going to spot, oh, you are dropping. I'm going to pull you up back and then take you in the right direction. You take the NCLEX exam and then you pass. Unlike me, I never had any support. I was just all over the place and all that kind of stuff. Right. I had support at the end because I got a mentor, right? Who I also call a coach as well too. Right. At the end of the day, who helped me out. Right. Because most of the thing I know now, I learned it from three people. Right. So yes, this is what you just need to know. Right. And I'm going to see you in my next video.